everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're going to dive a little into pharmacology and talk about a group of medications called beta blockers. Stay tuned for the questions at the end of this video to test your knowledge on what you've learned. So let's look at what we're covering today. What are beta blockers? How do they work? How to recognize their names, their side effects, and safety in patient care. Let's get into it. So, what are beta blockers? Beta blockers are a group of medications primarily used to treat cardiovascular conditions, basically heart conditions, such as hypertension, heart failure, myocardial infarction, and coronary artery disease. They help to relieve the strain and stress on the heart. I've covered most of these heart conditions in my previous videos. Be sure to check those out. Now, let's look at how beta blockers actually work, the core mechanism of action. To understand this, we first need to look at the receptors in the heart. The heart has what we call beta-1 receptors, and those are the receptors that hormones like epinephrine, commonly known as adrenaline, and norepinephrine bind to. When they do, they trigger a sympathetic response, your fight or flight reaction, which increases your heart rate. But as the name suggests, beta blockers work by binding to those same receptors and blocking those hormones from attaching, which results in a reduced heart rate and conduction rate. So if you look at the diagram here, we can see the hormones approaching those receptors and the heart preparing for that increased rate. But when a beta blocker is taken and arrives at the receptors, it binds to them and blocks them, keeping the heart rate slow and steady. Now, looking at how this applies to the heart conditions we mentioned earlier, let's take hypertension as an example. When the heart rate reduces, it reduces cardiac output, which is the amount of blood pumped out with each beat, and that reduces the pressure in the arteries. And now it's something like tachycardia, which is that fast, irregular heartbeat. Beta blockers work by slowing down the heart's electrical conduction and the overall rate. So, how do we recognize beta blocker names? Some common examples include metoprolol, bisoprolol, cadavrilol. Did you catch the pattern yet? A simple trick to recognize most beta blockers is to look for the olol suffix. Once you know it, you cannot miss it. Now, let's talk about side effects. Connecting everything we've discussed, most of the major side effects of beta blockers tie directly back to how they work. Because the lower heart rate and blood pressure, they can lead to bradycardia. That's an abnormally low heart rate, as well as hypertension. Other side effects include dizziness and nausea. It is important to note that beta blockers should be used with caution in patients with asthma because they can trigger bronchospasms. Now, let's tie everything into safety and patient care, what we monitor for, and how we apply this when caring for our patients. One of the key things to monitor is vital signs, specifically blood pressure and heart rate, since those are the two things that beta blockers directly affect. As a general rule, we hold beta blockers if the heart rate is less than 60 beats per minute or if blood pressure is low. We also want to monitor ECG for an irregular heart rate. And it's very important to monitor liver and kidney functions to monitor for drug interactions and potential toxicity. And because beta blockers can cause dizziness and lower blood pressure, we need to educate our patients to rise slowly when getting up to prevent falls. Okay, now at the beginning of the video, I mentioned we'll be going through some questions. So let's get into those. First question, how do beta blockers effectively lower blood pressure in patients with hypertension? Take a moment to look at the options. If you said by decreasing cardiac output via a reduced heart rate, that's correct. Second question. Which of the following medication is identified as a beta blocker based on its naming convention? If you remember the memory trick, you should have this one. If you said metoprolol, that'll be right. Third question. Why must beta blockers be used with extreme caution in patients with history of asthma? If you said to trigger bronchospasms, that's right. Fourth question. Besides monitoring vital signs, which physiological function should a nurse monitor for to watch for drug toxicity and interactions? The answer is liver and kidney functions. And lastly, what effect do beta blockers have on its heart electrical system in conditions like tachycardia? If you said to slow down the heart's electrical conduction, that's correct. And that brings us to the end of this video. If you enjoyed the questions at the end, please let me know in the comment section so we can do more of that. Thank you so much for watching. Please like and subscribe, and I'll see you in the next one.